wanted to give an update on where we're at with COVID-19. It's May the 19th, and the country's opening back up, which is good. We are still getting about 20,000 new cases a day in the country, and about 1,000 or 700 or 800 in Virginia. But I wanted to just sort of outline a little bit of where we're at and maybe a little bit of hope for the future. To talk a little bit about, it's very confusing. There's a lot of facts out there, a lot of guesses, and there's a lot of uncertainty still. So I just wanted to review a little bit about the testing to start with. So there are two types of tests. The first one is called PCR, or polymerase chain reaction. And what that does is it's the swab up the nose we've all heard about, and it gives you a result because it amplifies the DNA, or the genetic material, the RNA actually. And so it gives you a result. You should be able to get a result pretty quickly, but labs are taking still way too long, and we're hoping that as labs ramp up, that we're going to be able to get testing back within a day or two. But we just had one of our staff who was somewhat exposed out in her community, and it took 5 days for her result to get back. So there are some instant tests that have come out from Abbott and some other people that should give results in 15 minutes, but they've been found to be unreliable. At least they're not sure whether they're reliable because it's too new to know, and it depends a bit on when you do the test. When you think about what happens is the virus gets into your system through your nose or your eyes and into your lungs and into your bloodstream, and it starts multiplying. If you try testing that first day, you're probably going to get a negative result even if you were exposed and you're going to get it. So the test is much more accurate if you do it when you've got symptoms. So testing people who are asymptomatic before those 5 or 6 days before you get symptoms, it's less accurate. So it's not as helpful as we would like it to be. We would love to have a test that's going to predict, oh, you've got it and you're going to, but that's not going to happen unless till we get more and more accurate tests. It also will show up some of the virus even after the virus is dead, because it's amplifying the DNA or the RNA that's there even after the virus is dead. So sometimes you hear of people getting reinfected, but there's not much evidence that anybody's ever really been reinfected. They were just detecting the genetic material sometimes 2 or 3 weeks after all the symptoms went away, and people thought maybe they got reinfected, but most of the evidence is that that's not happening. It's dead material that you can't infect somebody else. So that's interesting. The second type of test is serology, where we're actually measuring the antibodies against the virus. This is the same test that we use for HIV, and the same test we use for hepatitis, and we can also measure antibodies against measles or mumps and see if you've ever had those diseases or you got vaccinated. IgG, the antibodies start showing up about 1 or 2 days after you've gotten symptoms. And then those antibodies persist for a long time, for months afterwards, and maybe years afterwards, and with some viruses for the rest of your life. We don't know how long they're going to persist with COVID-19. It's looking like they're going to persist for at least a few months and hopefully a year. They seem to do that with other coronaviruses, but probably not give you lifelong immunity. As long as you've got antibodies there, you probably have some immunity, which means that you probably can't catch it again, and you probably can't infect others. But we don't know any of that for sure, so we've got to make the best guesses that we can. So the serology tests are useful. They're doing some community-wide serology tests to see who's had exposure, and we're getting results from all over the map. Some communities have only had maybe 1%, and some people are saying that in a place like New York, they've maybe had 20% of people who have actually got antibodies and therefore have had infection and have now recovered. But that seems much higher than most people think, and so currently we don't think nearly as many people have been infected as we would like, because one of the studies I just showed that of the people who came in and got serology tests where they were sure that they've had corona and that they'd had it, only 38% of those people actually had the antibodies for COVID-19. they'd had some other cold, they'd had some other symptoms like the flu or just a regular common cold, and it wasn't corona at all, which means, unfortunately, that they're still vulnerable to get it again. So this brings up a vaccine. You know, a vaccine obviously is giving people dead virus in order to make them make antibodies and then get protection for themselves and also protection for other people so they can't catch it and pass it on. That, I think, is going to be what's going to get us out of this mess. And the good news is there's about 100 different vaccine companies working feverishly to make a vaccine. And even last night there was the news that a couple of companies have actually got some results back from humans in what's called a phase 1 trial, where they're testing it to see, is it A, safe, and B, is it actually producing antibodies? And the good news is it is. In fact, the study that I saw said it was producing more antibodies, a higher level than the regular infection causes people to get, which is encouraging, because with high levels of antibodies, it's probably going to be pretty protective. I even saw something that England are looking like they may even be able to get 30 million doses of vaccine by September into their population. So that's earlier than we were originally thinking. So I think there is some hope there. So it looks like the best we can figure, if you do get it and you have antibodies, you probably are not infectious to others and you probably can't get reinfected. We don't know 100%, but common sense says that's pretty true. It looks like corona antibodies are probably not going to last forever, but probably for a year or so. So that's kind of encouraging. And it looks like a vaccine is going to be probably able to be made at some point soon. So I think in some ways the goal is to stay safe now, because if a vaccine's coming within the next few months, then the whole idea of let's get everybody infected in the country so that we can develop herd immunity and protect ourselves that way, that doesn't make a lot of sense to me when we've got a disease that it's at least 10 times more fatal than the regular flu. And so I think my advice is to protect yourself, keep as safe as you can until the vaccine comes out. But more will be revealed, as they're saying, because we're learning more about this all the time. Thank you.